webinar today on safe routes to healthy food, where food access and active travel intersect. My name is Michelle Lieberman. I'm the Technical Assistance Manager with the Safe Routes to School National Partnership, and I will be your webinar moderator today. Before we get started, a little bit about the National Partnership. If you're not familiar with us, we're a nonprofit organization that's working to improve the quality of life for kids and communities by promoting active, healthy lifestyles and safe infrastructure that supports walking and bicycling. Before we get started with the rest of our webinar, I want to point out a few housekeeping items in GoToWebinar. On the left, you'll see the viewer screen, which you'll see the presentation, and on the right is the control panel. Here you can raise your hand, ask questions, and select your audio mode. Please note that the panel will collapse automatically when not in use, so if you want to keep it open, click the View menu and uncheck Auto Hide Control Panel. There are two options for listening to us today, telephone and mic and speakers. If you have a sound problem with one selection, try the other. And if you run into any technical issues, send us a chat message and we'll try to address those. So everybody's muted today, but we want to hear your input. Please use the questions box to ask speakers questions for the Q&A portion of the webinar, and we'll try to get to those at the end as much as we can. And I'm sure that you'll be wanting to refer back to this webinar, so just to let you know, we will be recording it and adding it to our website under the resources header and then select webinars. And this will be up in the next couple of days and available for watching afterwards. So now on to our speakers. We have two speakers today, Marisa Jones and Caroline Harries. Marisa serves as the Nutrition and Physical Activity Project Manager for the Safe Routes to School National Partnership. In this role, she works with communities across the country to adopt policies and improve opportunities for physical activity, walking, bicycling, and healthy food access. Marisa works on the Voices for Healthy Kids initiative, through which she leads the Safe Routes to Healthy Food Task Force in partnership with Caroline. Caroline Harries is an Associate Director with the Food Trust, and she supports the development and implementation of policies to encourage healthy food retail development in underserved areas throughout the country. And a little bit more about the Food Trust. The Food Trust mission is to ensure that everyone has access to affordable, nutritious food and information to make healthy decisions. The Food Trust works with neighborhoods, schools, grocers, farmers, and policymakers to develop a comprehensive approach to improve food access that combines nutrition education and greater availability of affordable, healthy food. I encourage you to look at their website, foodtrust.org, for more information after the webinar. So at this point, I'm going to turn it over to Caroline and Marisa to introduce the concept of Safe Routes to Healthy Food.
Thank you, and hi everyone. This is Caroline Harries. Thanks so much for joining us today. We wanted to kick off our conversation with an example of safe routes to healthy food and the important impacts that result from the coordination of the sectors of healthy food access and active transportation. So pictured here is a new ShopRite grocery store that opened in August 2013 in the Allegheny West section of Philadelphia, a neighborhood that had been without a full-service grocery store for over 20 years. The grocery store is owned by Jeff Brown. He previously had been purely a suburban grocery store operator. In 2004, he opened his very first grocery store in a low-income, underserved urban neighborhood of Philadelphia. And that store was made possible in part with funding from a program called the Pennsylvania Fresh Food Financing Initiative, which was the first healthy food financing program in the country, which had been established to support grocery stores and other healthy food retail development in communities with no grocery stores across the state of Pennsylvania. So that program had tremendous impact on the food access landscape here in Philadelphia and across the state, and has become a model now for about 10 other state programs across the country, and there's also one at the federal level. The creation of the Pennsylvania Fresh Food Financing Initiative was the result of the recommendations of a task force that the Food Trust led back in 2003 in partnership with leaders in public health, economic development, as well as grocers themselves, to help better understand the challenges to grocery store development in underserved areas, as well as ways to better support their development in these areas. And so Jeff Brown, the owner of this ShopRite, participated on that task force and learned of both the need for access to grocery stores in underserved areas, as well as the potential for his business to thrive with the right set of incentives up front to help overcome the extraordinary costs associated with developing stores in these neighborhoods. And so Jeff now is a grocer that operates about 7 stores in lower income urban neighborhoods of Philadelphia, including this market at Allegheny West, a market that he wouldn't have considered without the sort of nuanced understanding of the need and the potential impact that he could have through his stores. And then the impact of his stores has been maximized because, in part because he's coordinated with active transit routes, which benefits the customer as well as the viability and sustainability of his business. So recognizing the importance of active transit access to the grocery store, when developing this ShopRite, Jeff Brown worked with the Southeastern Pennsylvania Transit Authority, which is locally known as SEPTA, to ensure that bus routes would serve the store. And this led to the expansion of 2 additional bus routes, the 52 and the R, to enter the grocery store parking lot. And during peak shopping periods, the buses come about every 15 minutes. So this is a great example of how these 2 sectors can coordinate together and result in really important and impactful results. And now Marisa can elaborate more on the concept of safe routes to healthy food.
Thanks, Caroline. So as Caroline mentioned, that's a great example of a grocery store from the food access perspective and a transit agency representing active transportation coordinated to ensure that people would be able to get to and from the new grocery store even without a car. Unfortunately, that type of coordination is very unique. For too many people, getting to the grocery store or wherever they get food is a serious challenge. In fact, the USDA estimates that nearly 30 million people live in low-income areas more than 1 mile from a grocery store. This map on your screen displays the relationship between food access and transportation challenges. It shows census tracts where over 100 households lack vehicle access and live over a half mile away from the closest grocery store. So without the access to a grocery store or other healthy options close to home, that means that people in these census tracts and others are forced to travel outside of their neighborhoods to access nutritious food. And without access to a car, this can mean a long walk without sidewalks, a bike ride alongside speeding traffic, or a bus ride with inconvenient schedules or transfers. And for elderly people and families with small children, these transportation challenges can be even more acute. And so what we want to present to you today is the work of overcoming transportation challenges to healthy food access, a concept that we're referring to as safe routes to healthy food. It's about looking at where inequities in healthy food access and active transportation overlap, and then crafting solutions that take a more holistic approach to solving them.
So to further understand the topic of safe routes to healthy food and how food access advocates and active transportation advocates can work together to improve safe, active travel to food venues, and we're going to use a moderated Q&A format for this webinar. I'm going to ask questions for Caroline and Marisa to answer, and as always, at the end, we'll have time for questions from the audience, so definitely put them in the chat box as they come up. So let's start by defining some key terms to make sure that we're all on the same page. This is particularly important when bringing together folks from different sectors. We can't assume that we understand each other's key terms and definitions. So let's start with active transportation. Active transportation can mean a lot of things. What does it mean in the context of safe routes to healthy food?
So the term active transportation refers to human-powered transportation. We're talking about walking, bicycling, skating, rolling in a wheelchair. And as it relates to safe routes to healthy food, we're talking about using human-powered transportation to get to and from where a person accesses food. When we think about what those active transportation modes are relative to safe routes to healthy food, we're talking about walking, biking using your own bike, biking using bike share, public transportation, so bus, light rail, subway, trolley. And we're also talking about car share and grocery shuttles. So why does public transportation count? People often wonder, why does public transportation count as active transportation? And even more people wonder why car share counts. Research shows that taking public transportation usually requires walking to and from stations. According to a systematic review of literature on physical activity and public transportation, between 8 and 33 additional minutes of walking per day can be attributed to public transportation use. Similarly, car share typically requires a walk to and from where you pick up and drop off the car.
Great. So similarly, to have access to healthy foods can mean a lot of different things. So what does it mean in the context of Safe Routes to Healthy Food?
Sure. So for the purposes of the Safe Routes to Healthy Food Task Force, healthy food access means being able to easily get nutritious food at prices people can afford, and also with the information and skills to prepare and eat it. And we're working towards supporting healthy food access at a variety of healthy food venues, by which we mean places where people buy or obtain food. And these can include things like grocery stores, places like corner stores, bodegas, farmers markets, and a lot of the things you see pictured here on the slide, even community gardens, urban agricultural plots, soup kitchens, food pantries, summer after-school meal sites, and even mobile markets. So again, we want to recognize the variety of places people access food and work towards safe routes to all of these venues to maximize the impact of this effort.
Thanks, Caroline. Who needs safe routes to healthy food?
Well, everybody needs to eat, so we all need safe routes to healthy food. But the need is most acute in low and moderate income communities, in rural communities, and in communities of color.
Can you tell us a bit more? Why is the need most acute in low and moderate income communities and communities of color?
Sure. So a lot of research has demonstrated the high need for healthy food access, particularly in low to moderate income communities and communities of color. So we've worked with PolicyLink, which is a research and advocacy organization based in California, to compile the report that you see here. It's called Access to Healthy Food and Why It Matters, and it actually has a prequel called The Grocery Gap, which is also available on our website. And together, these two reports summarize the research on food access over the past 2 decades. So it's like a lit review and summary of food access studies and research. And the evidence continues to suggest that many families are underserved by healthy food across the country, and that the problem is most pronounced for residents of low-income communities and communities of color, as well as rural areas. In fact, many studies have found that low-income neighborhoods, rural neighborhoods, predominantly Black neighborhoods, and predominantly Latino neighborhoods have fewer supermarkets and more convenience stores than higher-income urban and white neighborhoods. And that's important in part because supermarkets have a year-round sustainable source of produce and fresh foods as compared to convenience stores. Specifically, it's been found that low-income zip codes have 25% fewer supermarkets and 1.3 times as many convenience stores as middle-income zip codes. And then predominantly Black zip codes have about half as many supermarkets as predominantly white zip codes, and predominantly Latino areas have only a third as many. So if we go to the next slide, you can see the results. In many of these neighborhoods, without a grocery store nearby, people living in food deserts must rely on small neighborhood grocery stores, which tend to sell limited healthy food options and food that is both poor in quality, as well as often more expensive relative to supermarkets. And this problem is compounded in lower income areas where cart ownership rates are low, making it even more difficult to get to places with healthy food. In contrast, when people live in communities with a supermarket and access to other healthy food retail venues, they tend to eat more servings of fruits and vegetables, and this is from the research. So a lack of access to healthy foods in lower income areas is affecting the health of these communities. As many on the phone probably know, during the past several decades, obesity rates have increased markedly, and in 2011, 1/3 of U.S. adults were obese. Now, the causes of obesity are complex and numerous, occurring at social, economic, environmental, and individual levels. However, improving healthy food access has been shown to be an effective measure in improving healthy eating habits and lowering the risk for diet-related diseases. more on the research, which shows that residents are more likely to meet their dietary guidelines for fruits and vegetables when they live in a census tract with the supermarket. And for African Americans, one study showed the produce consumption increased by 32% with nearby access. And neighborhood access to healthy food and safe places for physical activity also matters for children's weight. So children living in neighborhoods with healthy food and safe play spaces are 56% less likely to be obese than children in neighborhoods without these features. And then finally, adults living in neighborhoods with supermarkets and grocery stores have lower obesity rates as well. In fact, in Los Angeles, a study found a correlation between the distance traveled to a grocery store and body mass index, and longer distances are associated with higher BMI. So that's a summary of some of the research, which ultimately says that access to healthy foods is a challenge, particularly for low to moderate income communities, communities of color, and rural areas, and one that is significantly affecting the health of these communities.
So as Caroline mentioned, typically low and moderate income communities and communities of color and rural communities that lack grocery stores and healthy food options in their neighborhoods, which means that people must travel outside of their neighborhoods in order to access nutritious food. However, they face significant transportation challenges in traveling to these healthy food venues. The easiest way for someone to travel to a grocery store is likely by car, yet many families lack vehicle access. And low-income families are more likely to rely on active transportation options to access groceries. Compared to 95% of households not participating in SNAP, only 66% of SNAP households use their own vehicle to get to the store where they usually shop for groceries. So without their own car, people must rely on a friend or family member to drive them, or they could take an expensive cab, or they could use active transportation, meaning that they could walk, they could ride a bike, or they could take public transportation. But the infrastructure to support safe walking and biking and convenient public transportation is often lacking in low and moderate income communities, rural communities, and in communities of color, even though these are the communities most reliant on those travel modes. For example, sidewalks are only present in 49% of low-income communities, compared to 90% of high-income communities. And this lack of adequate infrastructure to support safe walking and bicycling can have fatal consequences. Black and Latino people are twice as likely to be killed walking, and African Americans are 30% more likely to be killed while bicycling, and Latinos are 23% more likely to be killed bicycling compared to their white counterparts. Public transportation is another active travel mode that people use to access healthy foods outside of their neighborhood. In fact, there's another picture from the Allegheny West ShopRite that Caroline introduced at the beginning of this webinar. But too often, these public transportation routes fall short of meeting the needs of communities. Transit routes may not link the places that people live, where they work, and where they spend time with the places where they want to obtain food. That's because transit schedules may not align with preferred grocery shopping schedules, particularly if individuals' work schedules fall outside of a typical 9-to-5 workday. In the absence of routes that link people's homes and places of employment with food options, the reliance on transferring between different modes of transit, for example, switching from the metro to the bus or switching between bus lines, adds a level of complexity. And it also adds time. So families carrying home perishable grocery items like milk or fresh meat may worry about buying those items, and fresh meats, dairies, and produce for fear that it may spoil on the long trip home. And this disproportionately affects low-income communities and communities of color. So a little bit of summary on the research on this. A high percentage of public transportation users are low to moderate income, with 2/3 of riders having household incomes of less than $50,000 per year, and 20% of public transportation riders having a household income of less than $15,000 per year. Black residents are 6 times more likely to use public transportation than white, and Latinos are 3 times more likely. Yet, Blacks and Latinos are also the population groups that may not have the most direct and connected routes, again, even though they're more likely to be using them than white riders. And an example of that is in Boston, Massachusetts, Black commuters spend 66 hours more per year than white commuters waiting for, riding, and making transfers on the bus. And in the Twin Cities, Minnesota area, Latinos spend 46 hours more per year, again, waiting for, riding, and making transfers on the bus. So although many of these seem like they're urban examples, safe routes to healthy food are essential in rural areas too. We're talking about even greater distances in rural areas, and yet there are more than 1.6 million rural households that do not have access to a car, but yet they still need to get to healthy foods. And often in rural areas, there's a severe lack of accessible public transportation systems and active transportation infrastructure to support those people, those 1.6 million rural households that don't have car access. So hopefully through this summary of research that Caroline and I provided on the inequities in healthy food access and active transportation, you can see that we're really looking at where these two inequities overlap. So we're looking at some of these neighborhoods are the same places. The neighborhoods that lack healthy foods close by tend to also be the neighborhoods that lack the supportive infrastructure for active transportation.
Great, that's a lot of great background information. Can you share with us some examples of what Safe Routes to Healthy Foods looks like in action?
Sure. So what we've, through the research that we've been doing on Safe Routes to Healthy Food and all the examples that we've been collecting from across the country, we've really found that examples of Safe Routes to Healthy Food tend to fall into 2 categories. So first, there are broad efforts undertaken at a systems level. And then secondly, there are specific efforts that are aimed, they tend to be place-based, they tend to be trying to overcome a very specific challenge to accessing healthy foods by walking, bicycling, or public transportation. So we're going to start with giving some examples of these broad efforts. So here's one example from Siler City, North Carolina, where in 2013, the city was undertaking a new pedestrian master planning process. And one of the really unique things that they did is that they took food access into account and made recommendations and prioritizations on where to improve walkable access to food venues that served and sold healthy foods. So they actually went through and did an analysis of the nutritional quality of the food served in a number of grocery stores and other food venues. And then this pedestrian master plan developed recommendations to prioritize sidewalk connections, multi-use greenways, and multi-use side paths that connect those stores that were deemed to sell nutritious foods and residential neighborhoods. And I encourage you to, I have a link to this later in the presentation, I encourage you to take a look at this because you can see in the pedestrian master plan that there are a number of other food venues that sell unhealthy food, such as some of the convenience stores, convenience type stores that Caroline mentioned that tend to have less healthy food and more expensive options. And you can see in this pedestrian master plan that sidewalks and increasing connectivity is not prioritized to those places, but only to the food venues where they've been deemed to sell nutritious food.
Thanks, Marisa. And then another example of this sort of broader, more systems approach to support safe routes to healthy food is from Nashville, Tennessee. Their metropolitan planning organization put together their 25-year regional transportation plan. And for that plan, the staff did an analysis of how roadways in the Nashville area can better connect residents to food retailers. So a very intentional examination of their systems, their transit systems in connection to healthy food access. So the analysis was overlaid with maps that identified neighborhoods with lower income, minority, and elderly residents who would benefit from transit links to food retailers that did not require owning a car. And the MPO included the analysis of food environments and community populations in the ranking and funding of transportation projects as one part of a comprehensive approach to promote the health and wellness of residents in the Nashville area. So they were really prioritizing these underserved areas and making intentional connections. And so this thoughtful process and connection between transit and food access and additional consideration of priority populations is a really great model of a systems approach to connecting safe routes to healthy food. And I'll say we met and learned of this group as healthy food access advocates, pulling together a task force in the Nashville and Tennessee area. And as we were talking about healthy food access, folks connected us with the Metropolitan Planning Organization's work. So it was a neat sort of connection that had already been happening, and we learned of really just coming at it from the healthy food access perspective.
I'm going to give one more example of a broad approach to safe routes to healthy food. And again, this is from Philadelphia, Pennsylvania. So this ties back again to the example that Caroline gave of SEPTA bus routes, coordination with the grocery store development in Allegheny West. So as much as we'd like to think this is just simply because the developer asked and then the transit agency said sure, it's really because SEPTA had identified improving access to local food via transit as an articulated goal in its long-term sustainability plan. And a lot of that has to do with coordination with the City of Philadelphia's sustainability plan and SEPTA identifying the role that they could play. They had a stated goal in their sustainability plan to bring fresh food within 10 minutes of 75% of residents. So when Jeff Brown, the grocery store developer, approached SEPTA with the request to extend the bus line to the new grocery store, SEPTA recognized that this did align with one of their goals. And so in addition to the expansion of bus routes to new grocery stores when possible, SEPTA actually does a number of other things, including they lease land that they no longer use to a community-based organization that uses it for an urban farm called the Walnut Hill Farm. And then the produce that's grown on this land donated by SEPTA, it's leased for $1 a year. It's then, the produce that's grown on that land has been sold as community-supported agriculture, CSA, at SEPTA's headquarters in Center City, Philadelphia. And then also to advance this goal, SEPTA coordinates with food access groups like the Food Trust to host farmers markets at transit hubs across the city. So that, we just wanted to provide a couple of these broad examples of safe routes to healthy food. And then we also have some very specific examples of safe routes to healthy food. And again, these are the examples that we're thinking are aimed at overcoming like one identified place-based concern. So this is an example that we learned about and were able to participate as part of their workshop through the EPA's Local Foods, Local Places program. So this is in South Dakota on the Rosebud Indian Reservation, where the Rosebud Economic Development Corporation, REDCO, has a community food sovereignty initiative that has been going on for a number of years. And as part of that, they completed a community visioning exercise for a parcel of land that's adjacent to a major residential area of the reservation. And you can kind of see on this picture, you can see where all that density is in the middle. That's where a large residential hub is on the reservation. And then the highlighted area you can see is where it's a Turtle Creek supermarket. And then also close to there are a tribally run farmers market and community garden. And the supermarket is also owned and operated by the tribe. And so they recognize that the food venues are there, the tribally owned grocery store, community garden, and farmers market. But with extremely low vehicle ownership rates, people are currently walking alongside the highway to reach the grocery store. So as part of that community visioning exercise, members of the tribe determined that a trail connecting them to the grocery store, connecting that residential area to the grocery store, would really improve and create increased food access and also provide a safe place for people to walk, to run, to ride their bikes, and to ride horses. Another example of safe routes to healthy food is in Spartanburg, South Carolina. So this is in a neighborhood that had previously been a grocery store desert and now is home to a farmer's market. So you can see in this picture that Spartanburg's bike share system is located right next to the farmer's market. And to ease the burden on parking and promote active travel to the farmer's market, a local philanthropy provides $5 market token incentive to people who arrive to shop at the farmer's market on foot or bike. So that's incentivizing both active travel to the farmer's market as well as purchasing the nutritious produce that is sold there. So another example that we, as a national partnership, learned about and were able to participate in through the Local Foods, Local Places program through the EPA is the Edible Rail Trail in Palmer, Alaska. So Palmer is the agricultural part of the state of Alaska, and where the state fair is. They have a very strong agricultural identity, but there are still challenges with local food access. So a community-based organization called Grow Palmer thought that one of the ways to overcome the challenges to accessing nutritious foods and to just get people more in touch with the idea of locally grown healthy foods, they would plant edible food along this multimodal trail. So they partnered with the city of Palmer, who funded the irrigation and the installation of these 22 planters along this rail trail that's used for walking and bicycling. As you can see in the picture, there are lots of people just strolling along, and you can see this woman in pink is at the planter. And in the planter, they have things like kohlrabi and kale and nasturtiums, edible agriculture that people just walk and pick as they are walking or bicycling along the trail. And then another example is from Portland, Oregon. So this is the Plaid Pantry convenience store chain that is trying to expand its business reach beyond people in cars. And so what they do is they provide ample bike parking in visible locations, which signals that they're accommodating to people on bikes. And they go beyond just providing bike parking. They offer an air pump, bicycle repair tools, flat repair kits, and they've actually incorporated some healthier choices into their convenience store selection for things that they thought would appeal to people walking and bicycling to their store. And then just one more example. So this is from Huntsville, Alabama. So in its second year as a summer meal sponsor, Huntsville City Schools recognized that action was needed to help kids get to the city's public summer feeding sites. And so what they did is they partnered with the city of Huntsville, which runs the Huntsville Shuttle, that's its public transportation. So they partnered with the city to offer free bus passes for school-aged children to get to the summer meal sites. And these specially designed bus passes are distributed to schools before school lets out for the summertime, and they provide these maps that show where the bus lines go, and you can see on here that there are summer meal sites clearly identified that indicate to the students where, which bus route to take to get to a summer meal site.
Those are a lot of great examples. Thank you for those. So can you talk a little bit about the benefits of food access advocates and those in the active transportation world working together to advance safe routes to healthy food?
Sure. Thanks, Michelle. I can start with a few. Certainly, safe routes to healthy food has the potential to improve health. I think that's clear from the research that Marisa and I have described. Increased access to nutritious foods and safe opportunities for physical activity can lead to decreased rates of weight-related chronic disease. There are also numerous economic benefits. So grocery stores serve as anchor retailers. They can help revitalize neighborhoods by attracting foot traffic to support nearby businesses and even attract additional businesses and investments into a community. They can increase property tax and sales taxes, and they provide really important employment opportunities. In fact, grocery jobs are ones that have no educational barriers to advancement. So in other words, you don't need advanced degrees to grow within the grocery industry. And grocery stores also catalyze additional public-private investment in neighborhoods. And research suggests that improving pedestrian and bicycle infrastructure in commercial areas such as walkways, bikeways, and bike racks can increase sales and economic activity at local stores as well. So by combining the development of food retailers and multimodal transportation options, it further promotes the economic vitality of a region. And certainly the impacts of each individual sector are amplified, we feel, when they're coordinated.
So another benefit of active transportation advocates and healthy food advocates working together is that it helps us be more efficient and effective. I think probably a lot of the folks on this call today work at nonprofits or in sectors where we're reliant on external resources, which we know are limited. And so if there's a way for us to come together when we identify that the challenges that we're working on are so complex and multifactorial and intertwined with one another, it makes us more effective and efficient at our jobs when we coordinate efforts and leverage resources and knowledge. Another benefit of coordinating active transportation and healthy food access is that it can help increase connectivity. And in active transportation land, we know that having a connected network of destinations makes it more likely that people will walk and bike to get around. And similar to what Caroline said about improving opportunities for employment and economic vitality, a strong transportation system, when we talk about safe routes to healthy food, when we're talking about investing in infrastructure that supports safe walking and bicycling and convenient public transportation to get people to grocery stores, but also to get them to other places. So we're talking about also getting them to places of employment, to education, to other opportunities. And another benefit of safe routes to healthy food is that it can build social capital and cohesion. First, it can improve perceptions of public safety by getting more people out and walking and bicycling, which puts more eyes on the street, which can help improve the perception of public safety. It can improve social cohesion when more neighbors are out walking, bicycling, spending time outside and having the ability to connect with one another rather than just, getting in and out of their cars and right into their garage, straight into their house without connecting with one another. And then to the extent that affected communities are involved in the development of safe routes to healthy food strategies, it helps build power and leadership. And an example of that is in Flint, Michigan, where the Flint Mass Transit Authority worked with community leaders to identify strategies for getting people to the grocery store after the grocery store on the east side had closed. And the MTA created a feedback loop for community residents to identify the best locations for bus stops on the grocery bus line, as well as make other recommendations for additional service options that would enable them to get to other food venues like the farmers market. And then finally, when people are spending less time traveling to and from the grocery store, as we talked about, perhaps these long or inconvenient public transportation rides, they have more time for other things, like being physically active for health or for recreation, spending time with their family, working to improve their health, or even just working.
Great. It sounds like there's a lot of great models of this work and benefits that make safe routes to healthy food really worth pursuing. Are there any concerns that we need to take into consideration when working to improve safe routes to healthy food?
Great question, Michelle. So yes, there are. So too often when a new grocery store or bike lane or bus stop comes to a neighborhood that previously lacked options for healthy food and for safe, convenient travel options, it can be accompanied by renewed attention to a neighborhood that can raise property values and price people out of the communities they call home. So as a result of that, one of the things that we really need to focus on when we think about safe routes to healthy food is how strategies that advance safe routes to healthy food can improve equity and mitigate the displacement of those communities. These new food venues and transportation options are intended to benefit. So what we're really saying here is that we need to be mindful that this can happen and prevent displacement. And we just also want to make sure that we're not using that the fear of displacement or gentrification as a reason not to invest or as an excuse not to invest in these neighborhoods.
That's a great point, Marisa. And we also want to make sure that when we make recommendations that improve transportation to food retailers, we're making those in the form of recommendations or incentives versus requirements that might create additional barriers that would ultimately prevent a retailer from opening a store in a lower income, underserved neighborhood. If you create onerous regulations that exist in one place and not another, there's the potential for further promoting the inequity by making it harder for food retailers to locate in communities with the additional layer of regulation. So it's really important to sort of connect with all the stakeholders and understand the implications of recommendations that you're making on both sides. And we can share the successes like the Fox Street ShopRite in Philadelphia, where coordinating with public transportation wasn't required, but was a savvy business move that promoted the viability of the store by ensuring a safe and convenient way for people to get there. And when you can particularly think about the wins for both sides, the wins for the community, very importantly, but also if there can be a win for the business success, that can further help make the case for your recommendations.
Those are all really important considerations. Can you talk a little bit about what work has been done to date to advance safe routes to healthy food?
Sure. So this work has been underway for several years. As Caroline mentioned at the top of the webinar, the example from ShopRite in Philadelphia, that dates back to the task force work that the Food Trust led starting in 2003. So this work is not new. As Caroline mentioned, they have been working with groups in states all across the country to really understand what the challenges to healthy food retail in underserved neighborhoods are for years. And in their experience, groups have almost always identified that one of those barriers to getting to healthy foods is active transportation, especially bus routes and other transit routes. So that has really bubbled up organically from leaders in economic development, in health, and from grocers themselves, from multiple regions across the country. So this work, this Safe Routes to Healthy Food work, naturally builds on recommendations that have bubbled up from these stakeholders. And from the perspective of the active transportation sector, our work has always been about connecting people to destinations. So speaking from the national partnership perspective, we grew out of the Safe Routes to School movement 10 years ago, getting kids to and from school, walking and bicycling safely. But we quickly realized that these principles that could be used for getting kids to and from school safely can also be applied to moving people of all ages throughout their communities to different destinations that they want to go to as well. So we've used these years of conversations in our respective circles. We've worked with external partners like Change-Led Solutions to further research the concepts. And then through an opportunity with the Voices for Healthy Kids initiative, which is an American Heart Association and Robert Wood Johnson Foundation initiative to ensure that all kids can grow up at a healthy weight, we have recently convened a national task force called the Safe Routes to Healthy Food Task Force. And so Caroline and I co-lead that group, which is a group of experts in food access and in active transportation, as well as community-based organizations working in food access and active transportation to really think through this topic and think about how can we put this into action. So, we've been thinking about this work separately, and this is really the time that we're able to come together and identify how to move it forward. So you can see a screenshot of this fact sheet that we released recently, and you can also find that on our website. That talks a little bit more about Safe Routes to Healthy Food, provides examples in addition to the ones that Caroline and I shared today. And then also through our work with the Safe Routes to Healthy Food Task Force, we have some forthcoming resources that are targeted at how specific sectors can advance safe routes to healthy food. So we encourage you to be on the lookout for those.
Great. It's wonderful to hear what's going on nationally. What steps can individual communities take to advance safe routes to healthy food?
Sure. So the most important part. So the first thing that I would encourage people to do is to shift away from thinking about food access and active transportation as completely separate from one another. Effective transportation systems are networked. They link people to places they want and need to go, like parks, grocery stores, and places of employment. And as we just talked about with the task force work that the food trust leads in communities across the country, transportation barriers consistently come up as one of the challenges for people getting to healthy foods. We also recommend that you work with community members to understand the barriers and challenges to walking, biking, and taking transit to access healthy foods. It's one thing if we have to look at the research that provides kind of the framework and the justification, but it's always helpful to know what the lived experience on the ground is so that the solutions can really be tailored most effectively to affected communities. Another thing that we would suggest is that you convene a meeting of local active transportation and food access stakeholders. Likely, if you're working in the healthy community space in one of these sectors, there's probably a parallel group from the other sector working on the same issues, or at least you have the shared goal of creating healthy communities. So you can potentially discuss how the work that you're each doing could be strengthened by working together. We also really encourage you to use data and maps to display existing bicycle, sidewalk, and transit infrastructure, and then compare that with venues where healthy food can be obtained. And use a data-driven approach to guide policy, to guide investments, and to guide programmatic decision-making. And similar to the example that I gave earlier on the Siler City, North Carolina pedestrian master plan, look for opportunities to support safe routes to healthy food in local plans like pedestrian master plans, bicycle master plans, sustainability plans like SEPTA and the City of Philadelphia did, and comprehensive plans. And then I'll turn it over to Caroline, who I think has two specific strategies for healthy food access advocates.
Thanks, Marisa. Yeah, and so similar to what Marisa just said, when speaking with healthy food access advocates, we think about coordinating efforts related to healthy food access with transit planners and consider active transit planning and the development of healthy food venues. And it's really, similar again to what Marisa said, it's really important to work to understand the community's perspective in terms of accessibility of a site and work towards locations that are active transit friendly and therefore accessible. The community has a really nuanced understanding of and perspective on accessibility, and it's really critical to understand that perspective. So, for example, when we were working to implement that Pennsylvania Fresh Food Financing Initiative I mentioned that had supported the ShopRite, it was a grocery financing program that gave out grants and loans to qualified healthy food retailers. We had an applicant that looked really great on paper. It was serving a low to moderate income area that was underserved, but with some community research, we determined that it wasn't the type of retail venue the community wanted, in part because it was not an accessible location from their perspective. It wasn't transit oriented, it wasn't easy to get to, and then additionally, it wasn't the format of store. It was limited assortment versus full service they were looking for. And so it was ultimately deemed ineligible for funding. So we can't underscore enough how critical it is to seek that community input on site accessibility and to work towards coordinating your efforts with transit planners.
Then just one other thing, if you are so excited after participating in this webinar and you just want to dive in and connect with other organizations that are interested in safe routes to healthy food, we really encourage you to join our Move Equity tweet chat on December 14th that we'll be co-hosting with the Food Trust, with America Walks, with Voices for Healthy Kids, Salud America, and Active Living Research, and we'll be discussing safe routes to healthy food. So tune in, participate, December 14th, Move Equity tweet chat.
Great. Thank you, Marisa and Caroline, for all that great information. And we've got quite a few questions coming in from our audience, so I'm going to try to get through a couple of these at least in our time remaining. First one, could you speak a little bit about potential funding opportunities for safe routes to healthy food?
Sure. So I can share two examples that we highlighted in here, actually. So both the Palmer, Alaska example, the edible rail trail, and Kayawakpala on the Rosebud Indian Reservation in South Dakota, those were both recipients of the Environmental Protection Agency's Local Foods, Local Places initiative that was able to pull community members and technical experts together for a workshop where they developed an action plan on how to put those ideas into action. And actually, I'll just point out too, on this questions page, you can see this is from Grow Palmer. So you can see it gives explanations on how to harvest Brussels sprouts and when rhubarb is ready to pull. So there's an educational component to their edible rail trail. And then another example that we highlighted in here, I'm actually going to scroll back up to this picture. So when I talked earlier about Flint, Michigan, their transportation authority, and how they were working with community members to identify what they wanted, how they could do a better job of connecting them to the grocery store since it closed in their neighborhood. They actually took advantage of a funding opportunity through the Federal Highway Administration that is called Ride to Wellness. And that was just launched last year for the first time, and they expect that it will happen again this year. And Ride to Wellness is supporting transit agencies, connecting people to opportunities for wellness. And when you look at who the grantees and the recipients were this year, they're predominantly trying to connect people to healthcare services. And Flint, they had the foresight and thought to say, you know, what would really help our community is connecting them to the grocery store. And so they're able to use this Rides to Wellness funding to pay for the Rides to Groceries bus in Flint.
And I'll just add to that, it's a great question, that the Food Trust works on a website with PolicyLink, that national organization based in California, a research and advocacy organization, and Reinvestment Fund, which is a community development bank based here in Philadelphia, but they do work really across the country. The site is healthyfoodaccess.org. And while it's dedicated to resources for folks advocating for healthy food retail development, as we've learned, so much of accessibility also includes transportation. And since this is a relatively new effort, you know, explicitly and intentionally coordinating safe routes to healthy food, we don't have a section on transportation and healthy food access. So again, it's sort of inherent in the work, and there's a section on that website called Funding. And available funding. And check out those resources there. We try to keep it relatively up to date because I do believe that a lot of the resources intended for healthy food access and healthy food development may also apply to working towards transit solutions to healthy food as well.
Great, thanks. Next question. Do you have, either of you have thoughts on the role of technology and in particular online food purchasing and how that plays into safe routes to healthy food?
That's a great question. I don't have an immediately great answer to the role of technology in online purchasing. I know that there have been some sort of virtual supermarkets established, for example, in Baltimore, with some success, setting up venues such as libraries where people can go and order their groceries. The one challenge is, sustainability. And so, again, in terms of supporting a long-term sustainable solution, we really believe in the business investment that grocery stores represent in underserved communities. But that's not to say I think there are some tech solutions being explored, and I think there may be more down the road. I think it's an emerging sort of response to this issue that we're, keeping an eye on.
Great. We have one question asking for examples from rural areas, if you have any.
Sure. So in rural areas, as we mentioned earlier, there are definitely major distance barriers that could be much further. It could be much further to bicycle in a rural area than in an urban area. And I say this as somebody who grew up in a rural agricultural community, so that was very real. Growing up, it was way too far to bike to the grocery store. So from the transportation perspective, we promote kind of a hub and spoke model to development and bike and pedestrian infrastructure in rural areas. So a lot of rural areas have that great small town development that happened so many years ago that includes a main street or like a small walkable downtown area. So what we would encourage is that locating a healthy food retailer in that kind of walkable downtown area, and then ensuring that people can walk and bicycle along that main street or in that area, so that maybe they do have to drive to get there, but then they could just park once and then walk and bicycle for the rest of their errand. And then in terms of transit agencies, so there are over 1,300 rural transit agencies, and public transportation just looks really different in rural areas than it does in urban areas. In rural areas, it tends to be demand response, which means that people request a ride through public transportation and then they get a van, for example. But then there are also some fixed routes. So we've got examples from northern Montana where the average length of a ride is 80 minutes. But one of the destinations that it connects people to is a grocery store. And similarly, in the Cherokee Nation, there's a public transportation system that will take people to qualified destinations, and grocery stores count as one of those qualified destinations. So there definitely are examples in rural areas, but they just look different than in urban areas.
Yeah, that's great. And I'll just add that sort of the effort so rural areas have seen grocers sort of leave some of the hearts of downtown, and one of the sort of food access efforts has been to preserve stores in downtowns, to prevent them from leaving. And through the grocery financing initiatives we work to set up, those programs can support sort of the renovation of existing stores in downtown. So for example, in Pennsylvania, there was a market, Kenny's Market, which was a family owned supermarket in the heart of Gettysburg, and they got funding to expand their store so they could stay downtown and continue to provide convenient, walkable access to fresh foods in an expanded and updated facility. So I just want to mention that aspect of sort of store preservation in rural areas as well, which promotes walkable access.
Great, thanks. You may have touched on a little bit on this in your background information, but are there places that you would recommend we would go to find data on locations of healthy food vendors and information about where those people are?
Yeah, actually, I'm going to send you back to healthyfoodaccess.org, and there's a whole mapping section with Reinvestment Fund that they have a technology called Policy Map, and they have enabled that policy map function on the Healthy Food Access portal so that if you go to the mapping section, you can actually map your region, and you can layer on the locations in your specific region of healthy food retail venues, including grocery stores and in some cases corner stores and farmers markets and that type of thing. So it's a really great resource, and I encourage you to check it out and play around with it and get a sense of the food access landscape in your region.
And just for variety's sake, I'll also add the map that I put up there earlier on the slide that says use data. That's from Community Commons, which if you're not familiar with, is a mapping engine that you don't need a lot of mapping experience to use, and they have data layers in there for both food venues as well as public transportation lines. So that could be a good place to start.
Great, thanks. Well, that's all the time we have today, so let's leave up the contact information for both our speakers. Don't forget, we'll have this webinar recording posted online on our website, saferoutepartnership.org, in the next couple of days. We'll also be emailing out a very quick survey, and we'd love to hear your feedback on today's webinar. And please join us for the Move Equity tweet chat on the 14th at 1 p.m. Eastern. And also join us for our next webinar in January. Thank you so much.
Thank you, everyone.
Thanks, everyone.